We have misconceptions about drug use here in Nigeria. And so from your family to your friends to your neighbors to everything, everybody feels that you are the problem of the society.
The society we are in now, they see drug use as a very bad thing to do. So they don't want to associate themselves with those people.
According to the most recent data, over 14 million Nigerians use drugs. Around 446,000 inject them, and out of those, 28,000 are living with HIV. Many also have hepatitis C. Stigma and fear of judgment at clinics leaves many people who inject drugs without the support they need.
There are people that are in hard-to-reach area. We say hard-to-reach areas because they hardly come to the hospital, and they constitute part of the population. I know that we have been having some patients that will be brought to the hospital, they'll be abandoned, and it's becoming a thing of concern. Some of them would have a lot of problem, medical and surgical problem. They have rights, they should enjoy privileges, but they hardly come to the hospital, and the hospital find it very difficult to go to them, because if you are in the hospital trying to treat diseases, particularly communicable diseases, there are people that have these diseases and you cannot reach them. They will not come to the hospital, and you have challenges reaching them because you might not have the capacity, you might not have what it takes, the skills to attend to them.
Drug-Free and Preventive Healthcare Organization, DAPHO, is a community-led organization working with people who use drugs in Gombe State, Nigeria. They are transforming care thanks to a new partnership with the Gombe State Ministry of Health and the Gombe State government.
We've been able to establish that relationship which allows public health facilities to even treat people who use drugs as a priority population. When we first came here, our first work was with the Gombe State Drug Control Committee. It was through the office of the Deputy Governor. The Deputy Governor has supported the program with everything. After that, we started engaging more with the Commissioner for Health.
We are trying to support them because we feel they are a group of people that have been neglected. And Gombe State government felt, no, they are our people. We should give them all the care they need, and we should also support them to go out of where they are.
It's been a relationship that has been seen, something that we would think in Nigeria is not possible.
DAPHO's community facilitators and outreach workers provide care and support and link people who use drugs to hospitals for specialist care.
I have a good rapport with the community members because as long as you're working with people, you must have challenges. But me being in the community, I know what they want, how they want it to be done.
The community facilitators refer clients for either cervical cancer services or the HIV testing services. So I ensure that the clients have been rendered these said services. And I also referred clients to the hospital. And in the referral process, I assess the clients. Let's say, for example, clients that sustained wound due to injection, I bring them down to the health facility.
They collaborate with us. They know what we want. They know what we do. They know how we do it. And then they have the trust of the community members. So they are standing in between, and they are bringing a lot of connection between facility care and community care.
With support from UNITAID's hepatitis C program, DAPHO's research into new needle and syringe technology and long-acting methadone treatment could reduce infections and save lives.
Through the relationship we've had, we've built over time that we are able to extend beyond just providing service at the specialist hospital to asking the permission of the specialist hospital to use their license and get their support and supervision to be able to implement the hepatitis C project.
Now, there's also another program that Gombe became the first state again to say Okay, there is those that are using drugs, particularly opioids. We could help them by giving them medically assisted treatment. We call it MAT, to reduce their urge and demand for the opioids. We have the political will of His Excellency the Governor Muhammadu Inuwa Yahaya to improve on what we are doing with DAPHO and other partners that may come to see that the objective is achieved.